Okay. Very good. So finally, we have a candidate in the San Fernando Valley and elsewhere, because the district is very large, that really cares about implementing Medicare for all. If you go to Shervin's website and look at his issues, you'll see that Medicare for all is right at the top. So it's something that certainly we've been trying to do in the state, in California, AB 1400, and next year we'll do something else. But definitely it's something that can be done nationwide too, if people in DC use their brains. Because in my opinion, and in our opinion, I guess, single payer is a no-brainer. It would save this country $400 billion, and California $40 billion in administrative costs, which could be used for all kinds of other things. Essentially, single payer means you need a doctor, you call the doctor, you go to the doctor, you come back home. I lived in Canada over a year. I got sick. I went to the doctor. I came back. I didn't have to worry about the details that everybody has to worry about, like copays and whatnot. I was in real health trouble just a couple of years ago, and I ended up with a seizure and ended up in Cedars-Sinai. And when I got home, I had bills that I had no idea. I was unconscious for 3 days, and I was being charged for my health care. So now we're going to have Shervin Aazami tell us what can be done nationwide. Why does he? Obviously, he has a long story of being involved with healthcare, but what can be done nationwide as well to implement, to bring Medicare for all as a reality for Americans? Okay, Shervin, it's up to you. Unless somebody else.
Thank you so much, Alberto. Thank you so much, Healthcare for All Los Angeles, Healthcare for All California, for the opportunity to be here with all of you. As a lifelong public health activist, as the former legislative director for the only national indigenous healthcare nonprofit, where we were fighting to ensure the federal government honors its treaty obligations to tribal nations for healthcare in perpetuity, recognizing that we stand here on stolen land, here in LA, the unceded homelands of the Tataviam, the Chumash, and the Tongva peoples, and every square inch of the United States is stolen land. And in exchange, through these treaties, it was supposed to be healthcare in perpetuity, in addition to many, many other services. And all of those obligations have been abrogated. But I want to talk about how, here in the wealthiest nation in the history of the world, poverty is inherently a policy choice. Our lawmakers choose to not implement single payer. And the movement for single payer is not new. It did not start with the Bernie Sanders campaign. Of course, we know that Bernie gave it so much more momentum and really propelled it to the national stage. But the movement for single payer goes back many, many years. It started here in California in the early 90s when we had a ballot measure to enact single payer. And it was actually the current speaker, Speaker Pelosi, who in the late 90s, early 2000s actually secured federal funding for the state of California to implement a study to implement single payer here in our own home state. So the fight for it is not new, but I think we could all agree that the fight for single payer is exponentially more urgent coming out of this pandemic, the worst public health crisis to face the American people, the entire globe, for over a century, where we have close to 1 million Americans who have lost their lives, so many millions more who have lost their wages, their jobs, their housing. And if this is not our clarion call to enact single payer, I really don't know what is. And especially as we continue barreling down towards climate catastrophe, the necessity for single payer is so much higher now, recognizing that from chronic diseases to infectious diseases, pollution rates, trouble breathing, asthma, all these chronic conditions are going to become so much worse in an environment where we have even more pollution, where we have even more famines, more droughts, more wildfires, where we have entire cities, countries that are submerged underwater, mass migration across the globe, melting polar ice caps, so much more. The necessity for single payer is so much higher. And I think what we have to recognize here is that the United States does not have a healthcare system. We have a sick care system. According to the CDC, we spend over $4 trillion annually on healthcare here in America, more than any other developed nation. Yet we have higher rates of chronic diseases, higher mortality rates, lower life expectancy, higher rates of infectious diseases. We have 1 in 5 Americans setting up GoFundMes, and they're straddled with medical debt to the tune of $140 billion collectively. These are the day-to-day situations that the American people are going through. And it does not have to be this way. We need single payer, and we have legislation before Congress to enact it. What we lack is the political will, because we have politicians that are bought and sold by their corporate donors and are occupying our seats, the people's seats in Congress, on behalf of those corporations. We saw it here in California. And it really, really irks me when we hear politicians say, we just need more Democrats. We need more Democrats. If we had more Democrats in Congress, if we fought off the Republicans, made sure they didn't win more seats, we'd have Medicare for all. We'll have the Green New Deal. Well, case in point here in our own home state, where we have a Democratic supermajority. AB 1400, the bill you're talking about, Alberto, was pulled from the floor of the state assembly after it passed appropriations, after it passed the healthcare committee with flying colors. It was pulled the last minute. And it was pulled not because the people of California don't want it. It was pulled because you had corporate Democrats that were worried about being on the spot, voting yes or no, and then having to deal with those insurance companies, the pharmaceuticals, the private equity firms that are bankrolling their election campaigns. So this is, again, how we see that popular movements for justice, popular movements to invest in us, invest in our communities, are stifled, are ignored, are just piled on with misinformation because of the fact that it takes away from corporate bottom lines. But what I am sick and tired of is the American people dying because we're more focused on maximizing corporate profits. We don't have time left for these issues, for more incremental steps, more Band-Aids on bullet wounds. Because what we're seeing right now happen, which we're not talking about to the level that we need to, is we are seeing growing privatization of Medicare. We all know that over the last decade, Medicare Part C, Medicare Advantage, has grown to be the largest segment of Medicare, even though we see study after study showing how there is billions of dollars of fraud, how patients on Medicare Advantage do not receive better care. They do not receive lower drug prices. They are not getting the coverage they deserve, even though they're paying more and more out of pocket. And it's the same thing with the Affordable Care Act. Every single year, premiums are going up. Every single year, the cost of prescription drugs, whether they be generic drugs or new patented drugs, they continue going higher and higher and higher. Why? Not because with these generic drugs or any of the other ones, the formulas have changed, but because these companies can get away with charging more. Because we don't allow Medicare to negotiate drug prices. We allow them to hold on to their patents for as long as they want, because at the end of the day, it's their profit margins that matter, not guaranteeing that coverage and that life-saving care for the American people. And enough is enough. We saw a new report from the Congressional Budget Office that's headed by a Republican saying that we save hundreds of billions of dollars per year with Medicare for all, that physician salaries would increase by a range of around $30K to over $130,000, that there'd be so much more time that nurses and doctors and all provider types have to actually invest in what they were trained to do, which is patient care, as opposed to doing more paperwork, as opposed to fighting with prior authorizations from the insurance companies, as opposed to having to deal with the pharmaceuticals. I'm the son of a primary care physician. I have so much respect for my father, for the struggles that he went through, escaping religious persecution in Iran as a teenager, going to Italy, becoming a medical practitioner in Italy. And then when we moved to the States when I was an infant, he started from ground zero, went back to school and became a primary care physician. So this is someone who really loves the profession, really loves patient care. And he's pulling his hair out every single day because he keeps telling me I can't do what I was trained to do. I'm spending the bulk of my time just filling out paperwork and arguing with insurance companies that, hey, look, I, as this patient's doctor, know what should be prescribed. I know what their treatment regimen should be. But that's not the way our system works. The patient and the doctor do not decide what the healthcare regimen should be. The insurance companies decide. The pharmaceutical companies decide. The private equity firms decide. That's not the way it should be whatsoever. And as I said earlier, spending more than $4 trillion annually on healthcare, more than $12,000 per person. Yet we think about the fact that less than 3% of our annual spending on healthcare actually goes towards public health prevention, goes towards health promotion and disease prevention. Why? Because the money is made in the sick care system. The money is not made preventing diseases from happening. The money is not made investing in our community so that we can lead healthier lives, investing in food security, investing in housing, investing in clean air and water, investing in transit, investing in public education, the things that actually lead to better health outcomes over time. We don't invest in those things as inherent human rights, even though if we did, we would see exponential gains in public health outcomes. But again and again, that's not the way our system works. We live in a society where your zip code dictates your ability to survive. You know, in our district, we have the city of Brentwood, a wealthier part of Los Angeles. Life expectancy in Brentwood is 10 years higher than in Inglewood, less than 40 miles away. That is institutional racism baked into our system. Again, we spend more than every other developed nation on healthcare. Yet we have higher rates of maternal morbidity, higher rates of infant morbidity and mortality. We have high rates of chronic diseases and so much more because we're not investing in our communities. We're investing in maximizing profits. I want to share one example that my family recently went through. You know, my wife and I, we just had our first child. He's now 10 months old. But when my wife was pregnant, you know, I haven't had health insurance coverage for about 2 years now. And my wife qualified for Medi-Cal here in the state. She enrolled in Medi-Cal for her primary care. That was the only care that, she enrolled in separate care in Covered California for her primary care coverage, but was eligible to enroll in Medi-Cal for dental and hearing. And when she did, they kicked her off for private coverage while she's pregnant. While we're trying to go to see her OBGYN, she's kicked off her private coverage because the system had messed up. And we're on the phone for hours and hours and hours saying, we're entitled to enroll in both Medi-Cal and private care coverage. Yet we're being penalized for doing it. And that's just one small story of the egregious stories the American people deal with every single day. Going bankrupt because of a medical emergency, not able to afford to buy a home or start a small business, start a family, pay for rent, pay for basic necessities because they're straddled with medical debt. That should not exist. Medical debt should not exist, period. We should cancel every last penny of it and enact single payer Medicare for all here in California and across the entire country. And on day one, I will never stop advocating for it because I've been a healthcare advocate my entire life and I will never stop fighting for single payer.
Excellent. That's the best health Medicare for all pitch that I heard in a long, long time. I guess we have the opportunity to ask you questions. So if anybody has a question, please unmute and go ahead. Otherwise, Paul has a question.
Yes, I'm Paul Newman. I'm with Healthcare for All Los Angeles, and I am the co-host here also. But what I've noticed more and more, if we had a single payer healthcare system, the repercussions, and I'm asking you this, Shervin, could be immense. It could be clean water. It could be stopping corporate pollution where they pollute and then they force us to clean it up with our tax dollars. I mean, it would create a chain reaction it would absolutely be enormous. And not only for healthcare deserts, where people, the nearest hospital's like 50 miles away, it would increase that, it would increase the economy. Do you know, would you happen to have any idea of what on an economic level for businesses and everything, how would this affect them?
I'm so glad you brought that up, Paul, because I really do feel like single payer is a form of stimulus in and of itself. Because you have so many small businesses, medium-sized businesses, and more that are paying so much money for their employer-sponsored healthcare coverage. And if that was not the case, that money could be reinvested in higher employee salaries, in expanding the business, investing in local infrastructure, whatever it is. It would provide so much more freedom. And for our unions as well. Our unions would no longer have to continue fighting for healthcare coverage for their members. That would be guaranteed. And they could now focus their attention on everything else, from improving benefits, workplace safety, improving collective bargaining rights, whatever it may be. That frees up their time and gives them so much more flexibility. But one thing I would really want to stress too here, in addition to the cost savings, is that in my view, we need single payer because we need to guarantee coverage, but we also got to address access. And you talked about that with, hospitals being 50 miles away. As someone who worked with indigenous communities, that was the reality each and every single day, where you have a place like Navajo Nation, which is roughly the size of the state of West Virginia. You have 2 grocery stores. And we heard countless stories of people who would have to spend the entire day driving to the closest behavioral health clinic or driving to the closest specialty care clinic. Or you had situations where you had a snowstorm in the community, and so the roads were shut down and people were not able to get to their dialysis appointments and died because of it. So, and we saw here across the country how during the early days of the pandemic, we had physicians, nurses, health providers wearing trash bags because we didn't have PPE. We had hospitals that had a huge shortage of beds, shortage of medical supplies. I mean, the average age of US hospitals is over 10 years. For hospitals in Native communities, it's 40 years. In hospitals in other impoverished communities, even more. And so we really got to be focused on rebuilding our public health infrastructure as well. And of course, as we're seeing with all of the turmoil that our healthcare providers are going through with this pandemic, all of the burnout, we are seeing providers leave the profession in droves. And this was happening before COVID, mind you. Before COVID, California was already dealing with a massive nurse practitioner, and primary care physician shortage. That shortage is now exacerbated because of all the burnout providers are feeling because of the pandemic. And so in my view, we got to go further than single payer Medicare for all. We got to rebuild that public health infrastructure by investing in building new public hospitals, expanding community health centers, and really creating a pipeline for youth to enter the healthcare profession within their own communities. And we got to address the fact that there are far fewer kids that are entering medical school and deciding to go into family practice because it's those specialty care careers that have higher salaries. And given the exorbitant debt that students that go to medical school come out from, you're literally incentivized to go towards those specialty careers. And so that's why it's so important, in my view, to make medical school free. I think what better way to ensure that we're addressing our healthcare and public health needs than by making it easy as possible in terms of financials to go to medical school. In addition, of course, to I'm a huge supporter of tuition-free public colleges and universities, and of course, canceling every single penny of student loan debt. But I think we got to go further than that because we cannot, if we have a shortage of providers, we are in trouble, a huge, huge trouble. Our communities are in trouble. And so we got to address these issues collectively and really understand that in addition to single payer, we got to ensure that we have more mental health practitioners. We got to invest in more behavioral health practitioners. We got to expand hospitals, community health centers, and so much more. Tertiary hospitals, all these things work hand in glove. And so I'm really glad you brought this up because I think that if we were to really invest in these things, invest in public health, we would see so many economic ripple effects, beneficial economic ripple effects, where people have their care taken care of. You see higher productivity levels, higher levels of satisfaction in work, higher creativity levels, higher levels of happiness. Happier people are more invested in their communities. They're doing more work to take care of each other. And so these are all benefits that we'll see by finally guaranteeing single payer and rebuilding our public health infrastructure in tandem.
We have more questions coming up.
Please.
Jessa, go ahead.
I think Erica was first. Go ahead.
Oh, okay, Erica then.
Hi, you guys.
Hi.
Hey, Erica.
It's spring break for the kids, so I'm kind of running all over the house right now. But I wanted to jump on. I wanted to thank Healthcare for All San Fernando Valley for initiating this, and thank you for inviting us to co-host. Obviously, Shervin, as you know, we endorsed you, and it's hard to get an endorsement from us. But not only have we endorsed you, but we're crazy about you. And so that's even harder. We have heard and experienced so many candidates saying exactly what we want to hear. And then once they get into office, they don't act on what they've said. And I know this isn't the case with you. One, because you and I have had very, forthright conversations, but two, and I just kind of want to share this with everybody. I have never seen a candidate. There's other candidates we are supporting. And I'm thinking of one in particular who got into a race for a position at the last minute. I just want to share, Shervin, I don't even know if you know that I know, but I know Shervin has given this candidate his list, and we all know what lists mean. He's given this candidate his donor list. He's given this candidate money from his pocket. He has steered donations that were coming into him that would have boosted him in a level to this candidate because he believes so strongly in this candidate. And I've seen candidates support other candidates, but I've never seen a candidate give another candidate their list and their money. And I know you've given resources like the phone to call, the phone to text bank with, which I know how much that costs. So I'm sharing this with everybody to just really demonstrate, I think even more than Shervin can, that truly Shervin is a human being of his word and a candidate that will go all the way for Medicare for all if elected. So it's not a question, it's a statement. So I will stop talking. And I just want to say, thank you, Shervin, for running. And thank you so much. And I'm going to put myself back on off camera because got the kids in the background. But thank you.
Thank you for your very kind words, Erica. It's just at the end of the day, and I've said this on the campaign trail many, many times, I vehemently reject the savior complex. One person will not save the world. It is always about carrying the movement forward. All of us are committed to implementing Medicare for all. We're going to need to work with each other. I think for a long time, the left hand has not known what the right hand's doing, where our state officials are not working with our federal officials, federal are not working with local, and vice versa. And, in a world where we want to see Medicare for all, we're going to require that coordination across all levels of government. And so really working together, building that solidarity early is going to be important. That way, we can work together to achieve all of our goals of investing in our communities. So thank you so much for saying that.
Carolyn, go ahead and unmute yourself.
Hey, Carolyn.
Greetings. Hi, how's everyone this evening? Of course, as usual, I'm in 10 Zooms at once, but I wanted to particularly come, and you may have answered this, I don't know, but I read an article and I saw Paul kind of allude to something about the number of healthcare workers that are leaving, or even 24% planning to leave. And I just wanted to kind of get your ideas about what might be some solutions to or incentives to turn the tide on that. And I'm particularly concerned, being a member of the California Senior Legislature, and with the percentage of seniors in this state, how dreadful that impact could be.
Absolutely, and thank you so much for bringing that up, Carolyn. We touched on it a little bit. I was sharing how we here in California, we had a dire nurse and primary care physician shortage before COVID. And that was before all the burnout, all the turmoil, all the suffering that providers have gone through over these last couple of years. And we're seeing them exit the field in droves. A lot of that stems from the lack of empathy and investment in the sacrifices that our healthcare providers are making day in and day out. And all the misinformation out there, all of the attacks, the politicization of public health, all these things distract from actually taking care of our communities. And you said it best, it's our most vulnerable. They're going to be most exposed and most on the line because of these departures. And so I think, first and foremost, saying in the affirmative how incredibly important our healthcare providers are, making sure that they have hero pay for all of the extra time and investment they put into the pandemic, and really using some of the very unique, very innovative procedures and programs that I saw when I was working with Indigenous communities, where they had a pipeline for youth to enter the public health and healthcare workforce, get their trainings, and then come back and serve in their own communities. I think that's super important, one, to invest in local communities, but also because when you have people who are serving their neighbors, serving people in their own backyards, it can really help develop that sense of trust, that sense of community buy-in and support for one another. I think it's going to be super, super important to really improve the patient care experience and also grow local economies. But at the same time, also making medical school free is going to be a very, very important way to incentivize more and more youth to enter the profession. Same thing with making it a lot easier for folks to enter nursing, to enter PA schools, to enter the public health workforce. I think if we do all those things, it's going to really explode the amount of growth we have in these sectors. As I was saying earlier, with medical schools, so many students are incentivized to go towards those high-paying specialty positions because they're straddled with hundreds of thousands of dollars of debt when they graduate medical school. And so it's really a kind of a perverse incentive, and has fed into the shortage of students we're seeing now graduate and choose to go into residency in primary care. So these are some of the ideas that we have, in addition to really investing in building our public health infrastructure. There's just some of the ways that we can really address shortages within our low-income communities, especially within communities of color and Indigenous communities, but also really kind of create a culture of health within each community across the country.
Dessa, I guess it's your time.
Yeah, I'll step up. I'm with Healthcare for All San Fernando Valley. And Shervin, I met you at that rally on Hollywood Boulevard.
Yeah.
And I was very impressed with your experience and your passion. And so I'm really glad to give you this opportunity and to learn more about you as well. One of the things that means the most to me is the pragmatic aspects of legislation. As Erica said, we get so many promises from so many candidates, and and it just evaporates in smoke. And Healthcare for All specifically is focused on getting single payer in California, but obviously you're headed to the Congress, and that's where Jayapal's bill is, HR 1976. So I'd like to know a little bit about how because the federal legislation is definitely a heavier lift.
Mm-hmm.
So I was curious how you intend to approach that.
Yeah, no, thank you so much for asking. I mean, look, transparency is going to be super important, and being very upfront with our community, with our constituents about what the challenges are, what the obstacles are to achieving single payer. Not just saying it's going to happen, we got to get this, we got to get that, we got to elect more Democrats. That's not the answer. It's being very clear about, and really giving folks opportunities to get involved in civic engagement, get involved in advocacy, where we can say, like, these, for example, these are the committees that Medicare for All was referred to: Energy and Commerce, Ways and Means, the Budget Committee, and we got to literally get them through each, and then get it through the floor, and then get it to the Senate, go through the Health Committee, go through the Finance Committee, and start the entire process all over again and deal with all of their procedures, right? So it's really providing that opportunity for training and education to the community about what the challenges are, and giving them tools to get involved. It's what we did when I was working on the Hill for NIHB, the National Indian Health Board. We would give tribal leaders talking points, write letters for them, get them meetings with their local representatives. We would push local newspapers to publish articles demanding that their reps be held accountable to the policy priorities of the tribal leaders, and so on and so forth. And really kind of have that inside-outside strategy working hand in glove to push the bills forward. Because just co-sponsoring the bill is literally the bare minimum you can do. I mean, knowing from experience, all that goes in the co-sponsorship is a one-sentence email from Brad Sherman staffer John Alford to Congressman Jayapal saying, "Hey, please add my boss's name." That's all he's done. That's not saying that I'm an advocate for Medicare for All, especially when you had local Democratic clubs here in the Valley say, "Congressman Sherman, will you endorse AB 1400?" And he doesn't. It's examples like that really demonstrate who actually supports Medicare for All and who doesn't. And so just voting for it also is not the be all end all, because you do see a lot of members trading votes and voting yes on a bill they know it's going to get tanked in the Senate to try to save face and give lip service back to their constituents about how much they care about the bill. So we don't want to play those kinds of games anymore. So it's about being really clear and giving the community as many options and opportunities as possible, saying, "Hey, look, this committee chair, we just had a closed door meeting, or I heard from my other colleagues that they're planning on pulling the bill or canceling the hearing or delaying it or what have you." Make sure you call them or get on the phone with friends or family you may have in their district. Give them a call and say, "Hey, look, don't do this. Make sure this vote happens. Make sure the hearing happens," whatever it is. Giving folks as many opportunities as possible to get civically involved and really making it, removing those barriers of entry into the advocacy world. I think it's going to be a great way to really put more pressure on all of our members to do right by their campaign promises. And at the same time, I have some real concerns with the way membership in the Congressional Progressive Caucus works. You have a lot of members, Brad Sherman included, that are CPC members, but they are heavily, if not exclusively, financed by corporations. So someone like Brad Sherman co-sponsored Medicare for All, but has millions of dollars from private equity firms and Wall Street banks and other corporate players that are working behind the scenes to stifle passage of Medicare for All. So in my view, we got to declare affirmatively that if you want to be a member of the Congressional Progressive Caucus, you have to refuse corporate donations. That's where you actually demonstrate support for these important bills. And we know that you're actually invested in them, not just supporting them to fend off primary challengers. So I think there are a lot of tools in our toolbox to really put pressure on members and give voters as many opportunities as possible to get involved in advocacy.
So a couple of follow-ups to that. Do you think that that Jayapal is open to that funding restriction?
I would hope so. I really hope so, because I think it's important. I think if we're just expanding the progressive label for the sake of expanding the progressive label, it's going to be the same thing with the Democratic Party, where we have a huge tent and really can't get things done because we can't find consensus across such a big party of people. So if we're going to say, no, we're progressives, we got to define what that means. Yes, there's a spectrum to being a progressive, but there are certain things that are required. And one of them is refusing corporate donations. And I think really kind of building that awareness and really talking about that within our own communities and pushing our members to say, look, you want to say you're a progressive, these are some of the requirements, is some of the ways that we're going to really get the ball moving and really change kind of our collective consciousness around what progressivism means.
Yeah, and we were among those lobbying Sherman. Al pinned up petitions on his office door. And he did finally sign on, but he was the last representative for the Valley to sign on, and it's in name only. He's not an actual advocate. Right. And then you said you were about activating the base to contact legislators. Would you do that in conjunction with groups like ours that have that? I mean, would you notify us and then in turn we would notify our membership and
absolutely
and our colleagues in other organizations? Is that how you see that working?
That's exactly how I see it working. Yeah, absolutely. I mean, really, really mobilizing all of the organizations pushing for Medicare for All, from Healthcare for All to National Nurses United, Cal Nurses here, and all of the unions that are pushing for Medicare for All. We all work collectively on this. And so, yeah, what more powerful way to really demonstrate that you have a huge army of supporters from your regular voter to your your activist base that are working hand in glove with each other to push Medicare for All forward and hold our legislators accountable. Absolutely.
Any other questions? I have one stupid question. Last week, Barack Obama went to the White House to celebrate the Affordable Care Act that all Republicans oppose. And, obviously the Republicans would oppose, free chewing gum in emergency care rooms. Who knows? But is there a way of bringing those people that see Obamacare, Affordable Care Act into the single payer movement?
During the Obama's first term, when they were pushing the Affordable Care Act, back then when President Obama also wanted public option and then dropped it because of all of the opposition, I would hope so, because these are such popular movements. When we talk to regular voters and explain what single payer is, explain how there's no copays, there's no deductibles, there's no cost sharing, you have dramatically lower costs for your prescription drugs, you are the one choosing with your provider what your care looks like, you get to choose who your provider is. All these things, I mean, I haven't found a single person across the political spectrum, the most conservative to the farthest left, to say, I disagree with that. Nobody disagrees with that. So I think the more that we continue breaking down what Medicare for All is and explaining to the community why it's important, what it does for their bottom line, their own personal health care, the more and more people we get behind it. And it's already incredibly popular. And I think at some point, going back to my inside outside strategy, when you have a coordinated approach of putting pressure locally on the members, getting community leaders in their district, faith leaders in their district, advocates in their district, local press in their district, putting out message after message after message saying, we need you to do this, it becomes virtually impossible for the member to ignore it. And so accountability through that public pressure is going to be a very powerful tool to demonstrate that the people are behind Medicare for All, the people are demanding Medicare for All, and legislators can't keep running away from it. And if we do the work of arming our communities with the right talking points, the right letters, the right approach, the right messaging, we make it harder and harder and harder for members to keep putting out all this disinformation about Medicare for All, to keep putting out these reckless and ridiculous statements that it's going to cost us way more, it's going to drive up costs, it's going to make this or make that, it's going to take away your right to work with your doctor. The more and more we arm people with the right information, the less and less capable the detractors and opponents of Medicare for All are going to be to actually be able to continue saying all the ridiculous things that they're saying.
Paul, you have one more question?
Yes, I do. What I've learned from the Affordable Care Act, or anything, okay, anything. I'm hearing, for instance, they're trying to in California, they were trying to do this thing called the Kaiser Loophole. And the Kaiser, in case you don't know what I'm sure you do know what it is, but it means that everyone goes single payer except if you're a member of Kaiser. But the biggest red herring I see here is that you're still using private insurance. In the ACA, you're still using private insurance. And we all know that the people making the decisions for the claims are not doctors, they're businessmen. And they're deciding whether or not your claim is honored. Mm-hmm. And, that needs to be brought up in Congress. And I think Katie, what's her name?
Katie Porter.
Katie Porter has brought that up, and I think also AOC has. But I mean, that needs to be stressed, because private insurance is private insurance, and they're there to make a profit. So I was wondering if you could, say, tell me what you plan to do when you're in Congress regarding that. That it's such a red herring.
It absolutely is. And, I really appreciate you bringing that up, because you're right. It's still private insurance. I hear that a lot from folks who are on Medicare Part C. A lot of the folks are unaware that under Part C, you have insurance companies, private insurance, and private equity firms that are controlling and dictating your care, what gets covered, what gets denied. Even though it's a government-run program, they've been privatizing it for years and years. And Kaiser, all it is an integrated managed care system. It's just vertically integrated. I mean, that doesn't mean that it's public. It doesn't mean that it's single payer. Does not mean that you have no out-of-pocket costs. Doesn't mean any of that. So you're absolutely right. It's a red herring. We got to bring a lot more attention to it. And, we've really tried to bring attention to the creeping privatization of Medicare that started under Trump and is being continued under Biden. Yes, they've blocked new applications, but the ones that were existing are continuing. And that's, again, how they try to give lip service to the issue without actually doing the work of fixing the problem. Privatization is moving forward, even though they're not accepting new applications. The ones that already applied are still able to move forward with privatizing parts A and B. And we've been trying to do work here locally to inform our seniors that if you receive a letter from CMS saying that there are some changes to your healthcare coverage, to be aware and know that you can still opt out of being placed into a private plan if you're a member of Part A or B. And so education is super important, and we're going to continue carrying that message forward in office.
Great. Well, listen, this has been an incredible Zoom. We can continue if if some of you
I
want
think-
to.
I think Retta has a question.
Oh, Retta, go ahead, Retta.
Well, wait a minute. Yeah. I'm wondering, because we all know the majority of the people support a single payer system. So sometimes I think when we put it in the progressive department and people are hearing the word progressive, and I'm a definite progressive, but I'm wondering if we talk about it more in terms of this is the majority, this is what the majority of people want, and it's a majority issue, and keep pounding that rather than putting it off as, of course, it's the Progressive Caucus that's leading it. But I'm thinking maybe, what do you think? We need to talk in terms of it being a majority concern, a majority issue, a majority choice, instead of categorizing it too much. Do you have any thoughts on that?
Absolutely. I could not agree with you more, Retta. And my apologies if I was not clear about that. My point around the Progressive Caucus is specific to the Progressive Caucus. About, being a member of that committee, there should be certain requirements, and one of them should be not taking any corporate donations. But in terms of Medicare for All being a popular policy across the political divide, absolutely. That's why it's so important, again, to really provide that education to all voters about what it actually means for them, for their bottom line, for their out-of-pocket costs, and for the decisions they make with their own provider. Because you're right, it's a popular platform that's been around for many years, and we got to talk about it in terms of what it does for everyday people. So I could not agree with you more.
And I think the general public might be more inclined to say, oh, the majority want it. Well, what's that actually about? And want to find out more about it, as opposed to thinking it's only a progressive thing because we associate the word progressive with it. So anyway, it's just a thought. I think we need to think more in terms of it being the majority.
Absolutely. And, hey, like we talked about earlier, it's a Republican-led Congressional Budget Office that released a report saying Medicare for All saves hundreds of billions of dollars. I mean, you can't get any more clear than that.
Thank you.
Of course.
It's been wonderful hearing you talk about. Thank you.
Excellent. Well, we'll make. Hello, Erica. You have a question? No. Anyway, we're going to make this Zoom available through our websites and through our Facebook pages and so on, and we'll stay in touch with with Shervin's campaign because this is fundamental. If we get Shervin to the U.S. Congress, it will make a huge difference based on what we heard today. So thank you very much, Shervin. If anybody has any other questions or any issues, please let me know now. Otherwise, I'll stop recording and we'll make.
I've got a quick question.
Okay, go ahead.
Shervin, what is the biggest misinformation, disinformation, or that you've heard amongst the public regarding single payer? Not what the insurance company tells us, but what people believe.
How are you going to pay for it? Well, I mean,
no, not the question, but the thing that's insane, the disinformation that they've got, some warped sense of how it plays out.
That it's gonna ruin their care, and they're gonna have to pay so much more money. I've heard that so many times from people that under single payer, they're like they think it's another version of Affordable Care Act, where their premiums are going to go skyrocket, the deductibles are going to skyrocket, their prescription drug costs are going to skyrocket. They think it's another form of something like that, and it's just not true. And so that's been one of the biggest red herring arguments that we hear from folks. And so that's why we've been so clear about really providing that education about, no, it's zero copays, zero deductibles, no cost sharing, lower drug prices. You choose your doctor, you decide with your doctor what your care is, and so forth.
Oakley. Thanks for coming on tonight.
Of course. Thanks for having me. Thank you all so much.
Well, thank you very much, Shervin, and let's stay in touch and let's move
Good.
forward.
All right,
Okay.
everyone.
Thank
Have
you,
a great
Shervin.
night.
Orders are.
Bye-bye. No more recording.